So I chose Madeline Leninger's Transcultural Nursing Theory. This is a framework that continues to shape how nurses care for patients in our diverse healthcare systems. This theory was developed by Dr. Madeline Leninger, who was a nurse who believed that care is the essence of nursing. She noticed that nursing focused heavily on medical needs and that the cultural dimensions of care were often overlooked. Leninger argued that to truly care for someone, nurses must understand the person's cultural background, their values, beliefs, and traditions, because these factors directly influence how a person experiences illness, healing, and health. Leninger's central idea is that health and care are inseparable from culture. People's ways of expressing pain, coping with illness, and understanding wellness can vary from one culture to another. For instance, in some cultures, family members are expected to be involved in decision making, while in others, patients want privacy. Recognizing these differences allows nurses to tailor their care, not just treating the illness, but honoring the person's identity and their culture. To make her ideas practical, Leninger developed what was called the sunrise model. This model helps nurses consider multiple cultural and social factors when planning care. It includes elements such as religious views, kinship, their social life, and political views, and also their economic systems. All of these influence how patients view health and healing. For example, a nurse using the sunrise model might assess whether a patient's dietary restrictions are religiously based or culturally preferred before creating a nutrition plan. This ensures that the care provided is not only clinically sound, but also culturally congruent, meaning that it fits the patient's lifestyle and their beliefs. Leninger's theory provides a holistic foundation that blends science with human understanding. Rather than taking a one-size-fits-all approach, it pushes nurses to see the person behind the patient. It asks us to look beyond symptoms and diagnosis and to see that culture is a vital part of the care process. One of the most profound impacts of Leninger's theory is in nursing education. Today, many nursing programs include cultural competence as a core part of their curriculum. Students learn to understand cultural differences and that it's essential for safe, ethical, and effective care. For future nurses, they're taught to reflect on their own cultural views so that they can communicate respectfully across differences and to adapt care practices to meet diverse needs of patients and families. This approach prepares nurses to work in any community or healthcare setting. Leninger's work also has had a significant impact on nursing leadership. Nurse leaders who understand cultural care principles help create inclusive and respectful work environments. When leaders are culturally sensitive, they foster better communication among their staff, reduce workplace misunderstandings, and promote mutual respect. This type of leadership not only enhances teamwork, but also leads to a better patient outcome because the staff feel supported and patients feel truly understood. In both education and leadership, Leninger's theory strengthens the human connection that lies at the center of nursing. It reminds us that caring is not just a task, but it's a relationship that bridges culture and experiences. Leninger's transcultural nursing theory remains highly relevant for the future of nursing practice. As nurses encounter patients from different cultural backgrounds, this theory provides a framework for addressing critical issues such as health disparities and inequalities in care. By applying Leninger's principles, nurses can design care plans and policies that respect one's cultural values. An example of this would be a community health nurse can use this theory to develop culturally informed outreach programs for underserved populations while ensuring that the health education material is culturally appropriate. Ultimately, I believe that Leninger's transcultural nursing theory is essential for guiding our profession forward. Nursing theories like this one provide the structure and direction we need to combine evidence-based practice with compassionate care. It reminds us that nursing is not just about performing procedures, but it's about understanding people. As healthcare evolves with new technologies, shifting populations, and complex social challenges, Linear's message remains timeless. To truly provide effective care, nurses must see patients not only as individuals with medical needs, but as human beings shaped by their culture and their community. Linneger's transcultural nursing theory reminds us that caring is universal, but the ways we express and experience it are diverse. By embracing that diversity, we uphold the true spirit of nursing, which is one that is about compassionate and culturally aware care.